There has been some discussion recently about the concept of reaching so-called herd immunity by letting the virus spread. Herd immunity is a concept used for vaccination, in which a population can be protected from a certain virus if a threshold of vaccination is reached. For example, herd immunity against measles requires about 95% of a population to be vaccinated. The remaining 5% will be protected by the fact that measles will not spread among those who are vaccinated. For polio, the threshold is about 80%. In other words, herd immunity is achieved by protecting people from a virus, not by exposing them to it. Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. It's scientifically and ethically problematic. First, we don't know enough about immunity to COVID-19. Most people who are infected with the virus that causes COVID-19 develop an immune response within the first few weeks. But we don't know how strong or lasting that immune response is, or how it differs for different people. We have some clues, but we don't have the complete picture. There have also been some examples of people infected with COVID-19 being infected for a second time. Second, the vast majority of people in most countries remain susceptible to this virus. Seroprevalence surveys suggest that in most countries, less than 10% of the population have been infected with the COVID-19 virus. Letting the virus circulate unchecked, therefore, means allowing unnecessary infections, suffering, and death. And although older people and those with underlying conditions are most at risk of severe disease and death, they're not the only ones at risk. People of all ages have died. Third, we're only beginning to understand the long-term health impacts among people with COVID-19. I have met with patient groups suffering with what is now being described as long COVID to understand their suffering and needs so we can advance research and rehabilitation. Allowing a dangerous virus that we don't fully understand to run free is simply unethical. It's not an option. But we do have many options. There are many things that countries can do and are doing to control transmission and save lives. It's not a choice between letting the virus run free and shutting down our societies. This virus transmits mainly between close contacts and causes outbreaks that can be controlled by implementing targeted measures. Prevent amplifying events, protect the vulnerable, empower, educate and engage communities, and persist with the same tools that we have been advocating since day one: find, isolate, test and care for cases, and trace and quarantine their contacts. This is what countries are proving works every day. Digital technologies are helping to make these tried and tested public health tools even more effective, such as mobile applications to support contact tracing efforts.